Morning, Mom. It's time to get up and get ready to go to the center.
I think the best way to describe what we do here at LifeLong's Marin Adult Day Health Center is we are a stopgap opportunity to keep people out of institutionalization.
My mother had been here visiting in January, and in April I went to Florida to take her to an angiogram test. And so I had just seen her a few months before and she was fine, but on this trip there was something wrong. I couldn't put my finger on it, but I knew something was wrong with her. So took her to her doctors. They thought I was out of my mind. So I packed up her condo. We shipped her furniture, her car. We put her condo on the market and we flew to California. And 3 weeks later, she was in a coma and had to have a brain biopsy. And it turned out she had a rare brain vasculitis. Mom, you ready to She was a woman who lived an independent life and was on the go. After the brain vasculitis and after the dementia,
let's see.
She can't be independent anymore.
All right.
She is
Here's your first one.
a person who has to be assisted with just about everything.
He is the most wonderful son. Nobody could have a nicer person. He's just super.
We receive calls from family members at the point where the family member is noticing significant changes in the home.
He won't let me do anything because he thinks I might get hurt.
Good morning. All right. Good morning, Abraham.
Good morning.
All right, she's ready. I'll go get her.
I'll be waiting.
Okay, Mom. Abraham from Marin Adult Day Health is here.
Right.
You ready to go?
I'm ready.
There's not going to be anything easy about this role that you're embarking on as a caregiver, and I am so happy that you have chosen to come to LifeLong's Marin Adult Day Health Center. And I can promise you that this staff, this organization, this group of amazing people will help you in every way. We can help you with the times that are really tough, and we will be privileged to share the times that are really, really wonderful. If we didn't exist here in Marin County and we're the only adult day health center in the county, probably 30% of the folks that are here right now would need to be institutionalized in a nursing facility in the next 30 to 60 days.
The social worker told me, and I'm so grateful for this, she told me about this program and she said, you've got to get your mother in this program. She will love it, she will thrive, and it will really benefit her.
I would say definitely this is a perfect place for anyone's parent. I really would, and because it's just a great place.
I love Betty, and I love her son. They're happy, wonderful, warm people, and she enjoys it here. So I am the only licensed nurse here. I'm in good, close contact with physicians when there are major changes. Someone tells me they think there might be a problem, then I take care of it immediately. I notify the doctor right away.
My name is Maria Martinez, and this is my mother, Aurora Martinez. The center, she comes here 3 times a week. The days that she's attending, of course, she has the supervision. She's not as anxious. She's doing something. She's constantly active. When the doctors first diagnosed my mother's diagnosis, Alzheimer's, they were discussing. We had a family meeting and talked to my father and I. They sat us down and talked about possibility of preparing for placing her like in a skilled nursing facility, just because Alzheimer's is a very progressive disease. One big thing I notice with the elderly, they do not hydrate themselves. I know Dad can encourage her, but sometimes it helps if other professionals come into the picture. Like she'll drink more fluids by the nurse asking her to.
The best thing about the people that are advanced with their Alzheimer's here is there's a routine here. They come, they do the same thing several days, they see the same people, and then you get a bright glimpse of them where they will say something that's completely clear, and that's my favorite part of the day.
I know I can go to work. I know I do not have to worry that, oh, she wants to wander off or she had a fall.
I'd like to think that we extend a person's independence to be able to live in their community, whether it's in their family home or in a organized residential care facility for the elderly, which is still not skilled. We can extend their time this time of independence for up to 4 or 5 years.
LifeLong's program is the only medically supervised adult day health center in Marin. If I didn't have that respite, I couldn't be a kind caregiver, a kind son. I would be really stressed. I would be really depressed.
We consider it our privilege to be partners with you in this process. We believe we have the expertise, we have the compassion, we have the infrastructure and the support of a wonderful organization, LifeLong Medical Care, to be able to provide quality care for your loved one while they can stay in the home for a longer amount of time.
It's a different pathway. It isn't the pathway I think we adult children think we're going to take. We don't plan for that.
Mom's home. All right. Back from the center.
So if we're lucky, we have a program like LifeLong to turn to.
Okay.
And people need to know about this program, and people need to support this program in any way they can.
We are able to provide an array of treatments that are indeed like a skilled nursing facility, except just for the day.
It's just a great place. And everybody is nice, and it doesn't matter who you are. You know, they're nice to everybody. They're really great. I would recommend them to everybody.